For my extra credit project, I've decided to focus on an organism of interest to me personally, being Clostridioides difficile, or C. diff for short. The C. diff is a gram-positive, spore-forming obligate anaerobe. It's bacillus-shaped, and the organism was discovered in 1935 by Hall and O'Toole, and it was given its name due to the difficulty they had in isolating the organism in pure culture. And it actually wasn't until 50 years after the discovery, in 1978, that George et al. Discovered the association between C. diff and antibiotic-associated diarrhea, or CDI, which is the leading cause of hospital-acquired illness in the United States. Diagnosis of CDI has almost doubled between 1996 and 2003, and about 500,000 cases and 15,000 or more deaths are associated with CDI annually in the United States. So, with C. diff being an opportunistic pathogen, requires a few conditions in order to actually cause disease in humans. The first condition that needs to be met is a dysbiosis of our gut microbiota. This is normally caused by antibiotic use. And in addition, if the person is not already a carrier of C. diff, the C. diff must be introduced by an outside force, which could include C. diff growing on hospital surfaces from inadequate cleaning from other patients infected with C. diff, or even from a silent carrier to someone who's taking antibiotics. Virulent C. diff strains produce two toxins, named the A and B toxins. The A toxin, it has carbohydrate receptor binding, and it disrupts adherence and villus ends of the gut epithelial cells that the C. diff infects. And then both the A and B toxins stimulate the release of interleukin 8, which can recruit neutrophils to the site of infection, and the B toxin can even induce apoptosis of the gut epithelial cells. So, symptoms of C. diff infection, with it being an enteric infection, some outward symptoms can include diarrhea and dehydration. Otherwise, a lot of symptoms include inflammation, and if you actually look inside the gut of an infected individual, you'll see on the bottom, like in the pictures on the bottom there, nasty yellow plaques forming. And those plaques are essentially the C. diff and all of the epithelial cells that have been killed by the pathogen and all the immune cells trying to fight the infection. So, as with any other pathogen, prevention is obviously preferable to having to treat a patient. So, ways to prevent C. diff infection from occurring in the first place would be appropriate antibiotic use. So, not using an antibiotic for very mild infections that could just resolve naturally without antibiotic use. And then in terms of hospital infections, proper hygiene and cleaning of surfaces after dealing with C. diff infected patients, and overall discipline when working with C. diff patients could help prevent a lot of the hospital-based infections. In addition, there's actually a vaccination being researched currently against the C. diff toxoid, and early trials are showing great promise with this vaccination. And especially with patients who have recurring C. diff infections after an initial infection, the vaccination could prove to be very helpful in preventing those recurring infections from continuing on. Now, in terms of treatment for patients who are infected with C. diff, as with other enteric diseases, fluid and electrolyte replacement to combat the fluid loss due to diarrhea is a key player. And the antibiotics vancomycin and metronidazole are often used against the C. diff. And lastly, there is another treatment plan, which is the fecal transplant. So the fecal transplant is a transplant of fecal matter from an individual with normal gut flora into a C. diff infected patient. And this is actually shown to restore the infected patient's normal gut microbiota and thus helping to resolve the C. diff infection. So here's a little graphic of some really staggering statistics of C. diff infections. So as you can see, it mostly affects elderly, 65 and older patients. And about 1 in 11 of these patients will actually die from these infections. And additionally, as stated on the last slide, 1 in 5 patients will get recurring C. diff infections after their initial infection, which would be where that vaccine could come into play. And here are my references I used to put together this presentation, including all the cool graphics I've used throughout. And then lastly, I just wanted to thank Dr. Edelman for giving us this extra credit opportunity. Thank you so much.